Good morning, students. Today we'll see about suspension therapy. Suspension therapy is one of the therapeutic modality. It is used to do the eliminate gravity motions. Okay, mainly used to for the muscle power is 0 to 2. This muscle power it move on this treatment technique. After the 3 is move for resistance training. 0 to 2 is muscle power is go for suspension therapy. First, we'll see about introduction. The suspension therapy is a therapeutic modality of exercise therapy in which the extremity of the body is suspended in the air by ropes and slings attached to the fixed point, so that the effect of gravity upon the motion can be used or eliminated. Then Guthrie Smith frame on which a rope, scene, pulley and slings are attached to 1 or 2 points to suspend the extremity is most commonly used in the physical therapy practice. Then to move on the type of suspension, the 3 type of suspension there. One is the axial suspension, vertical suspension and pendular suspension. First move on the axial fixation. The fixation point, all ropes in which are attached with the slings to support the moving limb is located immediately above the center of moving joint. Then example, to strengthen the gluteus medium and minimus muscle, that is a hip abductors muscles. The point of fixation is positioned or placed immediately above the anterior marking of the center of the hip joint. The rope position at the fixation are attached with the slings to at the knee and ankle joint. The joint move the extremity in the parallel to the floor. Then vertical fixation. The fixation point for all ropes is located over the center of gravity of the moving segment. Then vertical suspension is usually primarily for support to the move extremity in the small range. To achieve the required outcome, it is often combined with axial fixation. Pendular suspension. It is a type of suspension. It's the axial suspension is changed to apply the resistance to moving limb. The axle is shifted to away from the acceleration of the joint. Example: the patient lies in the siding of the axle of the suspension is shifted to posterior to hip joint. Is mainly strengthened for the flexor of the hip joint. And next is more devices used with the suspension therapy. Clips, hooks, slings, cleat, and supporting ropes. These are four structures are used into the suspension therapy. First, we'll move on the clips and hooks. The clips are used to the attached with the rope, and the rope with the slings hooks are suspended on the suspension unit with one end. Other end is attached with the pulley or rope. Generally, S hook is used. The either end of the S hook is used according to the fixed point. Common clips are used for carabine clip, dog clip. The clip and S hook, three type of the clip used. Next, move on the slings. These are mainly used to support the limb, and each end is attached with a D-ring. Slings made up of canvas. The common type of the slings are follows: single sling, double sling, 3 sling, and a head sling. Then the cleat. It is made up of the wood. Wonderful. Have 2 or 3 holes. The cleat is used to alter the length of the rope. To alter the length of the rope, the cleat is a help in horizontal position, and to hold the rope by the frictional resistance, the cleat help in the oblique position. The suspension therapy for extremity, the hip joint flexion extension movement. How to produce the type of suspension, axial suspension. The patient is lying, and the patient is supine lying. The unaffected leg or lower leg is flexed hip and knee joint. Then S hook is fixed to the suspension unit. If it directly above to the hip joint. Then the cleat is attached, rope is attached to the S hook. Then one end of the rope is attached to S hook, other end of the hook is the cleat knotted to the cleat. Then the S hook is attached to the rope. Then the sling is attached to the hip, thigh region and distal leg region. Both D slings are attached to the S hook to the primary fixed point. Then you will move on the moving on a segment. These are this is a segment if flexion extension movement encouraged. In vertical suspension, you will move on the axis center of point of the moving segment. Okay, this is one disadvantage of the moving the small range of the movement. Then is a pendular suspension is away from the axial suspension, mainly used for resistance of the moving segment. Then hip abduction adduction. The type of suspension, the axial is suspension. The position of the patient is placed on supine lying. The unaffected estimate is abducted. Hip flexion of flexion, knee, hip and knee flexion, and to the hanging of the foot is from the stool, foot on the stool placed. Then moving segment is then placed on the S hook is directly placed on above the joint of the moving segment suspension frame. Then rope is attached to the S hook. Then cleat is other end is rope is attached to the cleat. Then S hook attached. Then sling is attached to the thigh region and lower leg region. The both slings D ring is attached to the S hook. These both move on the is placed on the S hook point. Then we will move. Then we will encourage it to the abduction adduction movement of the hip joint. With the vertical position, will placed on the center of the hip joint, the moving segment. Then pendular suspension is move on the is away from the axial fixation. Is mainly for strengthen the abductor and adductor muscles groups. Adductor muscle groups. Then okay students, today class is concluded. Thank you.